Alrighty, so today we are continuing with specific phobia, looking at now the psychological based treatments or evidence-based interventions for managing and dealing with specific phobia. So we're going to look at two main interventions today. We're going to look at systematic desensitization and cognitive behavioral therapy. If we have time, we'll try to cover the social treatments as well, which is psychoeducation. But again, I'm not sure how far we can get today. So we'll just see. I don't want to cram too much as well. So yeah, that's essentially what we're covering today. So looking at the psychological evidence-based interventions, there are two main types of treatments or treatment strategies or methods that we use to deal with specific phobia. The first one is called cognitive behavioral therapy, so CBT, and the second one is called systematic desensitization. So these are the two main ways in which we try to address the specific phobia's patients' thoughts and feelings surrounding their phobia. And by basically addressing their thoughts and feelings, we're also eventually addressing their behaviors with reference to how they react to the phobic stimulus. So the first type of psychological evidence-based interventional treatment that we're going through is cognitive behavioral therapy. So cognitive behavioral therapy is this idea that if we can change the way a person thinks about their phobic stimulus and we can change the way that a person feels about the phobic stimulus, then eventually we can also change the way that they behave towards the phobic stimulus. And when we say that we can change the way that they behave, we're referring to their actions, okay? We're referring to their ability to maybe not avoid the specific phobic stimulus. We're referring to their ability to essentially confront that stimulus and not just run away from it all the time. So that is basically what we're looking at when we talk about cognitive behavioral therapy. It's about addressing the negative thoughts that you have about the phobic stimulus. It's about addressing your negative emotions or feelings that you have about the phobic stimulus. And it's about addressing those unhelpful or unproductive actions, okay? And with reference to phobic stimuli, we normally talk about the behavior as being avoidance behavior. We want to get rid of avoidance behavior. And so one way we do that is by using CBT. So an example could be like if you have a phobia of flying and the stimulus is obviously fear of heights or fear of flying, the negative automatic thoughts that come into a person with specific phobia, the mind is that flying is dangerous, or this plane is going to crash, or, you know, this plane is going to land into the water and everyone's going to die. So that's the negative automatic thought. So through CBT, we're addressing these negative automatic thoughts. Negative automatic thoughts are just what the name suggests. They're negative, which means that they have some kind of negative association to them, and they are automatic. So the minute that you see the phobic stimulus, or the minute that you know you'll be exposed to the phobic stimulus, they just pop into your head immediately, okay? That's why they're automatic. So that's the negative automatic thought. Now, the emotion that comes out of this thought, if I'm thinking in my head that this plane's going to crash, the emotions I'm going to feel are fear, I'm going to feel anxiety, I'm going to feel, very unease, okay? It's a very negative emotion that I'm feeling there. So that's the emotion part of it. And now the behavior as a result of this is now that I'm going to refuse to fly, or I'm going to refuse any opportunity or any instance where I might have to go to an airport or might have to, go on an airplane or something like that. So essentially in this example, you can see that the thoughts that the person has about the phobic stimulus, which is flying, affects their emotions, which then goes on to affect their behavior. Okay, or avoidance behavior that people show when they have a phobic stimulus is never just behavior that occurs by itself. It's behavior that is fueled by the negative thoughts and by the negative feelings the person has about the phobic stimulus. So they're always connected, these three elements here. Okay, and cognitive behavioral therapy is a type of therapy or treatment in which we try to address the negative thoughts and address the negative feelings, and in doing so, we can promote more positive behaviors where the specific phobia patient is not trying to avoid the phobic stimulus. So that's the end goal of CBT as a therapy. Now, just be careful. CBT comes up 2 times in Unit 4 in the study design. When it comes up the first time in sleep, we didn't actually do that because it has been removed as a topic. So the only CBT or cognitive behavioral therapy you need to know is with reference to specific phobias, which we're doing now, not with reference to sleep, because that topic has been removed from your study design. Okay, so that's CBT. Now, the cognitive component of CBT is, I just explained this in the previous slide, but just to go into it in a little bit more depth, it's basically trying to change the irrational or negative way that people with specific phobia think about their phobic stimulus. Remember, we were talking about the fact that when people have specific phobias, they think in very irrational ways. They don't sound reasonable. They sound like they're exaggerating. They sound a bit dramatic sometimes. And it's not like they're mean to sound dramatic, but they're just that anxious about the phobic stimulus that it just sounds irrational. Okay, it just sounds illogical when they talk about their phobic stimulus. So we need to then teach them through the CBT that their fears are irrational. Okay, and part of that is firstly getting them to identify the negative thought, carefully examining each thought. So if I'm working with someone who's got a fear of dogs, I might ask them, okay, do you really think a dog is going to kill you? How many times have you passed by a dog in the street, and how many times has it actually harmed you? And then they'll be like, you know, thinking about it and backtracking and actually thinking about like eventually how unreasonable they are and how illogical it is to think that a dog is going to attack them on the street. Okay, and the statistical kind of unlikelihood of that actually happening. So essentially, it's about evaluating your thoughts and understanding that the negative automatic thoughts are not helping your situation. They're not realistic. They're statistically very not likely to happen. So that's essentially what the cognitive component of CBT is. It's addressing the negative thoughts. Okay, so that's what the cognitive part of CBT is. Now, CBT stands for cognitive behavioral therapy. So the cognitive part is about addressing the negative thoughts. What about the behavioral part? So if we go to the next slide, the behavioral part is simply about addressing those negative behaviors, specifically avoidance behaviors or any behaviors that don't help you to recover or to get over your phobia. Okay, so remember we talked about in the last class about the psychological contributing factors, and we talked about this idea of perpetuation, that phobias can be perpetuated or maintained through operant conditioning processes such as negative reinforcement. Okay, so perpetuation means that you're maintaining your specific phobia. So maintaining specific phobia through operant conditioning principles. Specifically, we're talking about negative reinforcement here. Okay, and what we said was that when a person, like if I'm scared of seagulls and I'm not going to the beach and I'm staying inside, of course, if I'm staying inside, there's no chance of a seagull breaking through my door, breaking into my house and, you know, landing on top of my head. But the likelihood that I'm going to see a seagull by staying nice and locked up inside my house is very low. And so by avoiding the seagull, I'm giving myself relief. I'm removing that negative stimulus or negative thing. And that gives me a sense of relief. So the next time there's a chance I might have to go out and see a seagull, I'll avoid that situation as well. And that's what negative reinforcement is about. You remove something that is unpleasant, and by doing that, you get a sense of relief or comfort. And that increases the likelihood that you will then engage in that avoidance behavior in the future. And that's what the idea of reinforcement is about. So just remember that the behavioral component of CBT, which is the B in the therapy, the behavioral component is about using behavioral strategies that will help you to get over those avoidance behaviors, that will help you to actually confront the phobic stimulus and to be more positive and react more positively when you are in the opportunity or in the instance where you are exposed to that phobic stimulus. So some ways in which we can actually carry out the behavioral component of CBT is teaching the patient breathing retraining, which we looked at in the last class, talking about, you know, breathing in a more calm way, how to relax their muscles, teaching them particular stretches which can help them to get rid of the tension that they feel in their muscles, teaching them new exercise workouts that are easy for them to do, that will again calm them down and give them a sense of relaxation. And meditation also helps a lot. So meditation is a really good method that helps them to focus on a particular stimulus without having all these thoughts of the specific phobic stimulus kind of barging through and invading their brain. Okay, so that's essentially what the behavioral component of CBT, doing actual behaviors or using actual behavioral strategies, actual actions. Okay, so that's what the behavioral component is about, doing actual things that will help you to feel better about the phobic stimulus or help you to get over that avoidance behavior that you have with reference to the phobic stimulus. So that's the behavioral component of CBT. Now, what are the limitations of CBT? So number one, the first limitation is that even though CBT sounds like a really easy and really kind of clever strategy, like the way you think affects the way you feel, affects the way you behave, it's easier said than done. So a lot of the time when we're talking about CBT, it's very easy to talk about this on a PowerPoint slide or talk about it in a textbook, but in terms of practical application, it is difficult to practically address phobia, and because some people actually develop phobias through some kind of a traumatic experience or a traumatic underlying experience there. So that's essentially one limitation of CBT. Another limitation of CBT could be that you're basically not able to get rid of those avoidance behaviors very quickly. And so one example could be that, for example, you engage in those avoidance behaviors over time, but then it leads to you feel so comfortable when you avoid the phobic stimulus. So it's not easy for you to just let go of those avoidance behaviors. They're your comfort zone. They're what protect you from the phobic stimulus. So again, it's not as easy as we say it is to just put aside our avoidance behaviors. Now, these behaviors are so strongly entrenched that undoing the connection between them is easier said than done. Okay, and a lot of the time, it's actually up to the patient. The patient is in control of whether they want to respond to this treatment. If you've got a patient who's completely stubborn and completely, hesitant to begin the treatment, or they're completely reluctant, you can't get anywhere with CBT. So it all depends on the patient's motivation and the patient's belief that they can actually get over their phobia. If the patient believes that they'll never get over their phobia of dogs, and that they're going to actually take that to their grave, there's no way that you can help them. So again, CBT is very dependent on patient motivation, and not all patients are the same. So that's some of the limitations. Just learn at least one limitation of CBT. You don't need to learn all of them, just any one is fine. All right, so the next treatment that we're looking at is a treatment called systematic desensitization. And this one also focuses on, addressing the specific phobia patient's thoughts and feelings relating to that particular phobic stimulus. And systematic desensitization is like exposing them to aspects of what they're scared of, aspects of the phobic stimulus progressively meaning little by little. Okay, so little by little, you're exposing the patient or the client to stimuli that approximates. Okay, approximates means comes closer and closer to resembling what the actual conditioned stimulus is, or what the actual phobic stimulus is. And eventually, over time, we give them little glimpses of the specific phobic stimulus until eventually they are able to be exposed to the actual phobic stimulus without producing the actual phobia fear response. Okay, now there are certain parts to this. So the first thing that you'd have to do is the psychologist would have to sit with the patient, and they'd have to first teach them relaxation techniques. So as they're going through each of these tasks in the hierarchy, and I'm going to show you what the hierarchy looks like in a second. As they're going through the tasks in the hierarchy, if it gets too much, they're able to regulate themselves and calm themselves down and get rid of that anxiety. And obviously, by creating the step-by-step hierarchy of tasks, you allow that person, rather than just exposing them to a dog straight away if they've got a fear of dogs, you're exposing them to little things that kind of resemble the phobic stimulus, but you're building it up slowly. You're not just exposing them straight away and giving them like another traumatic experience. You're exposing them slowly and you're easing them into it. And that's what systematic desensitization is. It's the systematic, which means step by step, desensitization. So the person is slowly, little by little, step by step, task by task, becoming desensitized to the phobic stimulus that they are actually initially scared of. Now, the aim of systematic desensitization is to disassociate the phobic stimulus from the fear response. And what do we mean by disassociate? Remember, we talked about the role of classical conditioning. Okay, classical conditioning is involved in the precipitation or the development of specific phobias. So when we talk about how the specific phobia was initially developed, we talk about a repeated pairing or a repeated association between some unconditioned stimulus and a neutral stimulus. Okay, and the neutral stimulus is what eventually goes on to become the phobic stimulus or the conditioned stimulus. Okay, so that's essentially how the association is made. Now, if we say that phobias are precipitated through classical conditioning or that they're developed through classical conditioning, well, we can undevelop them or undo them by disassociating, by undoing this association that we've made here. We can actually undo the fear response and get this person to be exposed to dogs without showing that fear response. It's not easy, but it's something that we can attempt or try to do. Okay, so systematic desensitization is the progressive desensitization of a person's phobic stimulus. So you're exposing them little by little to little glimpses of their phobic stimulus until finally you expose them to the phobic stimulus itself. Okay, and I'll show you what the fear hierarchy looks like. So this slide here is showing you an example of a fear hierarchy. So remember I said when a patient who has specific phobia is exposed to the specific phobia straight away, it could lead to a lot of trauma. It could lead to a panic attack. It's really dangerous to do that. So the best way we can do it is by systematically, so this treatment is called systematic desensitization. So systematically we are, step by step, we are desensitizing them to that specific phobic stimulus. Okay, and specific phobic stimulus is the thing they're scared of. So if we're talking about someone who's got a specific phobia of dogs, if I'm the psychologist, I'm going to sit with them. First thing I'm going to do is teach them a relaxation technique. So I'm going to say, okay, let's learn how to breathe in a calm way. Let's do some breathing retraining, and I'm going to teach my patient how to do that. If they don't like the whole breathing retraining thing, I'm going to be like, okay, that's fine. Let's learn another relaxation technique. Let's learn some meditation. Let's learn some, muscle relaxation techniques that you can use. Okay, whichever relaxation technique I teach the patient, they have to be good at doing that relaxation technique, because that's the technique that's going to help them calm down as they go through each of the stages of this hierarchy, okay, the fear hierarchy. So then I'm going to sit with the patient and I'm going to say, okay, I'm going to show you a bunch of tasks. I want you to rate them on a fear level of 0 to 100, with the last task being that you have to be exposed to an actual dog. So then we go about rating it. They say, okay, looking at pictures of small and large dogs, I would rate that 30 out of 100. And because that's the lowest number, I put that right at the bottom of the hierarchy. That's the first task that we're going to go through together. Okay, and then obviously it goes up. And the last task here is the actual phobic stimulus itself. Okay, so this is exposure. So this is exposure to the actual phobic stimulus itself. Exposure to actual phobic stimulus. Where's my thing gone? Exposure to actual phobic stimulus itself. Okay, so remember the phobic stimulus is also called the conditioned stimulus. So when we're talking about the phobic stimulus, remember we talk about the approximations or the little systematic step-by-step, the glimpses of the phobic stimulus. So the first thing is I go with the patient and I get them to look at pictures of small and large dogs, so from a book. Okay, that's fine, they're able to get through it, awesome, we've passed that stage. Next thing, task number 2, we watch a cartoon dog movie, okay, a movie about a dog, it's a cartoon animated movie. We're all good with that, awesome, so we've passed that stage as well. Next, we go through watching a real life dog children's movie where you actually see an actual dog in real life in the movie. It's not an animated one. They're kind of getting a little bit panicked at this point, but they're still able to manage their anxiety and handle it. So, yep, we've successfully passed through that stage. And then it continues to go on and on. Now, as we get further and further up the hierarchy, you notice that it gets a little bit more intense. So, for example, here, when we get to 4, 5, 6, when we get to task number 6, you can see that we've actually gone inside a dog park and you're letting the dogs actually kind of like brush up against you. So that's a little bit more intense. It's kind of like more exposure to the dog as compared to just watching a movie about a dog. And then you're going upwards even more. So you're petting a large dog. You're giving the dog a treat. You're letting a large dog lick your face. Okay, all of that is a lot more exposure to the actual dog compared to just watching a dog from a distance. So the further you go up, the more intense the tasks become. And you can see that the fear level is also a lot higher, the higher that we go up. So it's kind of corresponding with how the patient would experience and feel this. This is not something we can complete in one day. I can't complete from task 1 to task 12 or 11 in the space of 24 hours. This will take time. Sometimes some patients who have a phobia of dogs, their phobia is so intense and so extreme that they might not even be able to get through the first or second task easily. And they would go through a lot of stress to get through those tasks. So it depends on what kind of patient you're dealing with. Eventually, in order for us to say that, yep, systematic desensitization was successful in getting rid of the phobia or in managing the phobia, my patient has to go through this last stage, letting several large dogs lick their face. And obviously it's a very high fear level. They have to go through this particular task without showing any fear at all. Okay, and if they can go through this task without showing any fear or just showing a calm response, in other words, then I would say that, yep, systematic desensitization was successful in helping my patient to overcome phobia. So it's really step by step. It can be an ongoing process to get through this treatment, but eventually that's what the indication of successful treatment would be, that they can get through the last task, exposure to the actual phobic stimulus without showing any fear, without showing the phobia response. Okay, so that's what systematic desensitization is about. Now, what are the limitations of systematic desensitization? Well, number one, it can be a confronting method. Like I said before, some patients will not be able to even get through the first or second task, which is the easy task. Again, depending on how much fear they actually have. Now, all specific phobia patients usually are quite panicky and quite, they get quite anxious around the phobic stimulus. So it's not easy for us to understand what they're going through and understand that, it's just looking at pictures of dogs in books. What's the big deal? Can't you do that? But like we always talk about with phobias, phobias are deeply entrenched. They can be based on traumatic experiences. So they're not very easy to undo, even when you take it very slowly, even when you ease the patient into it. Number two is that obviously systematic desensitization can be time consuming. Like I said, this is not something that you can just complete in 24 hours. It's something that does take a lot of time, okay? It's something that can take months. It's something that can take even years, okay, depending. And sometimes patients can actually have some progress and then they can go back, okay, depending on whether they've had another traumatic experience with a dog while they were still completing the treatment. And again, it is time consuming and patients may lose hope. They may feel frustrated. They might choose to say, you know what, I don't want to do this anymore. I'm out of here. Or you know what, I give up. I just don't think this is working out and I can't be bothered waiting to see if it does. So those are some limitations of systematic desensitization as a treatment method. Just learn any one limitation, and essentially this is going to be important if we ever ask you to evaluate. Okay, if you ever ask to evaluate this as a treatment, you can give this give one of these limitations there. Alrighty. Now the last thing we're going to go through, because we do have a bit of time and I can probably finish this quite quickly, is social evidence-based intervention. So the social kind of treatment for specific phobia. And remember, social evidence-based interventions or social-based treatments are always about addressing the external factors relating to specific phobia. So addressing the environment, addressing the social environment that the individual is in, addressing factors like family. Okay, so remember we talked about the fact that a lot of mental disorders can have stigma. So depending on the culture you come from, depending on the family that you come from, if no one in your family history has ever had a specific phobia, your family might just think, why are you being dramatic? Why can't you just come with us to the beach? We're just literally going to the beach. Seagulls are not going to kill you. So they might not understand how you actually feel. So it's about really trying to get families, trying to get people who are living with that patient who has specific phobia to be more supportive and to be more kind of proactive in helping that patient rather than putting them down or making them feel guilty or ashamed or stigmatizing them. So that's what psychoeducation is essentially about. So psychoeducation for families and supporters is basically giving that psychological information and that psychological education about specific phobia to the patient. So if this girl has specific phobia and she's sitting with her, I don't even know who's the mum and who's the doctor in this case. Okay, if she's sitting, let's say this guy's the doctor. If she's sitting with her mum, essentially what the doctor is going to tell the mum is that, this is what specific phobia is about. Your daughter is not being dramatic. She's not exaggerating. This is an actual mental disorder and you have to try to understand that and support her. Okay, a lot of the time, parents don't actually believe something until like a doctor or like someone like who's like an expert in that field will tell them that to their face. So sometimes psychoeducation is important as a way of better supporting the patient who has the specific phobia. Okay, the intervention or this intervention of psychoeducation is based on this idea that the more education and the more awareness we have about the condition, the more effectively the people that are living with that specific phobia patient, like the siblings or the family or the roommates, whoever they are, can essentially treat that person better and reduce their stigma and understand that there are things that can trigger them and try not to do those things that could trigger them. So the two main goals of psychoeducation are, number one, challenging unrealistic and anxious thoughts, which is kind of related to that cognitive component of CBT, and number two, not encouraging avoidance behaviors. And this obviously is connected to this idea of families and people around you, because it's a social evidence-based intervention. So the first one is challenging unrealistic and anxious thoughts. So this is a really basic idea. Basically, if a parent has a child who's got a specific phobia, it's about working at home. You don't have to always go to a psychologist to change your thoughts. Your mum or your dad could actually help you in changing your thoughts, particularly if you're still a little kid and you look up to your parents a lot. Parents can be a powerful tool in helping children to get over their specific phobia. So rather than, if the child tells the mum, "Mummy, I think spiders are going to crawl into my ears while I'm sleeping," the mum could say, "Well, you know what, how many nights have you been sleeping this year?" And then the kid will be like, "Well, a lot." And then the mum might be like, "Oh, well, okay, how many times has a spider crawled into your ear?" And then the kid would be like, "Oh, none." Okay, hopefully none. So yeah, that would then obviously show the kid that their thoughts are a bit unrealistic and that their thoughts are just a result of too much anxiety that they're experiencing. So it's about challenging those thoughts, not accepting them. Now, if you're the mother and you're like, "Oh, come here, I know spiders are the worst thing in the world. You know, I just saw a spider while I was cleaning the house before, blah, blah, blah." If you're going to talk like that, then you're essentially reinforcing the phobia. It's about not accepting those things when your kids tell you things about the phobia, but challenging them, telling the kid that this is wrong and that this is not realistic and that, you know, we've got to change those thoughts. So that's what challenging unrealistic and anxious thoughts is. It's really straightforward and it's in the name itself. Okay, and this is the first goal of psychoeducation. And the second goal is, this is just an example of how we can change an unhelpful and unrealistic thought to a more realistic one. And the second goal of psychoeducation is not encouraging avoidance behaviors. So same thing, it's about role modeling. Okay, role modeling proper behaviors where children can approach the phobic stimulus rather than avoid it. Okay, so if a mother is going to scream when she sees a dog, her child might look up to that. And through observational learning, the child might actually start to also scream when they see a dog. And sometimes parents can actually condition phobias within their children because of this. So it's important that even if a mother is scared of dogs, that when they see a dog or when they see a spider or whatever they're scared of, they shouldn't do something that then models to the child that this is the correct thing to do. They shouldn't say, "Oh my God, it's a spider," or scream or run to the back of the room or climb on top of the table. They should kind of model positive behaviors, like standing in front of the spider and saying, "I'm stronger than the spider. I won't let it scare me." Most people won't ever do that, but you know, it's about encouraging avoidance behaviors, not encouraging avoidance behaviors. Okay, so again, another way that you can teach them is by teaching them proper behaviors. So you might teach the kid that, okay, when you're standing in front of a dog, just stand really still, just look really angry, and the dog will not hurt you. Okay, so sometimes things like that can actually help. Obviously, if you're dealing with dogs like pit bulls or ones that can actually harm the child, then probably better to give some other advice there. Okay, important to also reward or positively reinforce. So if the child does show courageous behavior in the face of the phobic stimulus, it's important to praise them and encourage them, because like we said before, operant conditioning can be used to modify phobias as well. So if we give a positive reinforcement to the child for being brave, for coming outside to the beach, even though they're scared of seagulls, that's a big step on their part, and we should encourage them so that it will increase the future likelihood that they will also come to the beach the next time as well. Okay, so that's essentially what not encouraging avoidance behaviors is about, and this is the second goal of psychoeducation. And psychoeducation is our social evidence-based intervention for specific phobia. Alrighty, and that brings us to almost the end. So the limitations, again, it's really straightforward, really simple. if you've got a family who is so stubborn on the fact that specific phobias are not a thing, no matter how much psychoeducation you give them, they just won't listen, okay? So that is one limitation. And number two, if you do have family members who have a deep stigma towards mental disorders in general, so it's not just about not accepting it, but they've actually got this negative stigma and they discriminate against people who have specific phobia, and they're like, oh my God, such a wimp, or oh my God, you know, such a weak person, to whoever has specific phobia, then obviously stigmas are very hard to break down, no matter how much psychoeducation. So sometimes it can actually be dependent on the actual people you're dealing with. If it's a family who's more kind of open and more accepting, it's easier for psychoeducation to break through and work with them. But if it's a family that's a little bit more stubborn, who's got more stigma in general towards mental disorders, the chances that psychoeducation will actually be effective might be quite low. Okay, so essentially that is what psychoeducation is about. And with psychoeducation, the patient themselves who has specific phobia doesn't have much of a control. Okay, you can't control whether your family will accept your mental disorder. That's something they have to do on their part. So unlike the other disorders, unlike the other treatment methods where the patient has some control over it, in psychoeducation, it's a social evidence-based intervention. So it's all about the social environment accepting and being open to changing their views. Okay, so that's basically just learning any one of those limitations as well for psychoeducation. And that's about it. So obviously just a little comic here that not avoiding the phobic stimulus is essential to proper recovery of a specific phobia, regardless of which treatment we're looking at, whether we're looking at biological evidence-based interventions, psychological evidence, or social evidence-based interventions. In all those different types of treatments, not avoiding the phobic stimulus is essential. So that's the best thing that you can really try to do if you have specific phobia, to ensure that you're not maintaining the condition and that you are trying to confront that phobic stimulus there. Yeah, that's about it for today. So please do the questions for the rest of these two spreads that we've done. I'll put them up on Social Stream as well. And I'll put up the recording as well. And if you have any questions, let me know. But if not, you're free to go. Yeah, and I'll see you guys tomorrow. Bye.
Bye, Miss.
Bye.